VKB Dr. Balakrishnan sir. Guest speaker is VKB Balakrishnan sir. Co-chair, I now warmly extend to welcome our chairpersons, Dr. Pradeep Shinde sir and Dr. Rudrakshi madam onto the dais. I would like to introduce our distinguished speaker. Now I would like to call Dr. Preeti Madam.
Balakrishnan has been an active academician and clinician with significant contributions as the medical superintendent at Government Ayurveda College, Kannur. Dr. Balakrishnan over the years has guided several PG students in their dissertations, published multiple research papers in reputed journals, and has served as a valued resource person for numerous seminars and workshops. Sir has also held very important administrative roles, including NABH coordinator, plagiarism chairperson, and member IEC and IQAC at Government Ayurveda College, Kannur. Sir has also been a speaker and member of judging panel for paper and poster presentations at national and international conferences, including the 9th International Conference of Shalakyatantra at JS Ayurveda Mahavidyalaya, Nadiad, Gujarat. With extensive clinical expertise, Sir manages over 140 OPD cases on an average, specializing in ophthalmology and ENT disorders. Sir is a highly accomplished Ayurvedic professional with over 25 years of experience in education, research, his distinguished academic records, leadership roles, and expertise in Shalakyatantra. We are blessed to witness your session today. Welcome, sir.
So as we know that the importance of Panchakarma. Tani upasthita doshanam sneha swedopapatane Panchakarmani kurvita matra kale vicharaya. Matra kalo vicharaya. So when there is upasthita dosha, the effect of Panchakarma comes. And we know about the basic principle as the treatment consists of two main aspects, that is Shodhana and Shamana. So Shodhana is clearing all dosha or impurities from the body. So we know that there are 5 types, that it is divided into 2, and according to Vagbhata and Sushruta there is some opinion differences there. Sushruta added Riktamosha as one of the Panchakarma. So it implies Rodho Shodhana, or bringing accumulated dosha from the Shakha to the Koshta and eliminating from there. Sneha Swedi Snehaklina Koshtaka Dhatukava Srotaulina Eja Shakasamsi Swedevi Samyik Nirhriyante. So benefits of Panchakarma. The first one is Buddhi Prasadam. Buddhi implies the intellect or intelligence or the ability to do a work. So basically when we are doing Panchakarma, the person is getting not only the improvement in the body, but also the brain. So the effect implies especially the spatial senses, the vision or the hearing. Buddhi prasadam balam indriyana dhatu sthiratvam jwalanasya deeptim chirachapaka vayasa karodi samshodhanam samyak upasyamanam. If we are doing in samyak way, if in the proper way we are following the Panchakarma therapy, the effective results are not in a single word we can't conclude. That much effect we can see throughout the follow-up. Even after 1 month or 2 months, even after 1 year. We can assess the result after 1 year. So basically, even in Netra Yoga, the causes are from Sarva Roga Nidana Uktaya. So if the causes are from the basic Nidana chapter, the treatment is also based on that. Again, in protective aspect, in Netra Yoga, Trifala Rudira Srudihi Vishuddhihi. When we have to protect or whenever we have to protect eyes, we need a Vishuddhi or what we studied in our Swastavirta, maintaining the health. Sravane Kartike Masi Chaitri Masi Sadharane Kramat or Shidodbhavam Dosha Chayam Vasande Vishodayan Grishma Jamapragale Khanate Vashika Mashu Samyak. We have to do the proper Rutucharya and Dinacharya. Then only we can protect our eyes. Even though if it is associated with the disease, along with the treatment, we have to follow the Dinacharya or Swastavrta regimen. These are the important treatment which is as per protocol. Vastirvirego vamanam tada tailam khridam madu. We studied in the first chapter when we entered in Ayurveda. The definition of vasti, where vastina diyade iti vasti, where we are using a bladder. So in the olden times, for doing yoga vasti or kashaya vasti, we used to use God's bladder for collecting the medicine and pushing the medicine to our parenteral route. Now we have changed it. Vasti, instead of we are using plastic covers. I think so. Actually, it is not good, I feel. The plastic cover cannot retain the temperature. Only the bladder which can control the temperature and the efficacy will be higher when we are using bladder as vasti bag. The importance of vasti, yata kusumbadi yuda toyena, toyat ragam haret padaha, tada drevigrita dehat vasti nehrede malan. As just like a color is affected to the cloth, if while washing as it goes, similarly the dosha will be removed from the body by vasti. Again, vitsleshma pittadi malachayana, vitshepa samhara karasya yasmat, tasyadi vrudyasya samaya nanyan, astir vina bheshadya masti kinjit, tasmat chikilsarda iti pradishtaha. Vasti is considered as best half of the treatment. Even though we are doing all other karmas, if we are not doing vasti, the treatment is ineffective. Or otherwise, vasti is considered the half portion of the treatment. After explaining all the chikilsa, when we are coming to the vadarikta chikilsa, nahi vasti samam ginjit vadarikta chikilsidam. As explaining that there is no treatment which is equal to vasti. So wherever the disease which is certain samprapti, the treatment, effective treatment comes as vasti. That's why nahi vasti samyam kinjit vadarikta chikilsitam. So it is the last chapter, where beginning chapter Jora, we start with vasti. So in Jora itself, in the after Kashayapana and the treatment, when there is Prakshina Kapha-pittasya, Trikaprishta Kadigrahe, Deeptagne Bhattashugda, Prayunjida Anuvasanam. Anuvasanam is explained even in Jora Chikilsa. We feel that how it can be applied. In a person of Jora Rogi, how Anuvasana can be applied. Thaila is, we know that it cannot be controlled, it cannot control the Jora. Even though as a principle, again, if it is the Jora is Dehadatu Abelatwacha Joro Jirno Anuvartade. If it is continuing, if the Jara is not coming down by any of the treatment, we have to go for Vasti Chikilsa. Again, Astapana Vasti is indicated in Jora. Similarly, when we are closing the chapter in Vadarakta, Vasti importance is told. In all the chapters, we can see the necessary documents of Vasti and effective Vasti. In Jora Chikilsa, Shira Prayoga is there. Again in Adhisara, Shira Prayoga is there. Even in Adhisara, Vasti is a main treatment as Bainai Picha Vasti. Ashavinti Adhisara, Picha Vasti Param Hitaha. We feel that how Adhisara Vasti can be indicated. But Ayurvedic principle, and it has seen that in my experience, I have seen that especially in the ulcerative colitis management, only Pichavasti can correct the disease. So Vasti is there throughout the textbook. Wherever we see the Chikilsa Prakarana, Vasti is an important thing. So Vasti is very, very important. That's why Tasmat Chikilsarda iti pratishtaha. So in Bastikarma Pradhanatama Mahu Acharyaha. So according to our science and Shalakyatantra, it is Chakshuhu Prinayati, which gives importance to the Chakshu, or it again nourishes the Chakshu by all means. So Chakshusya Basti is there explained in our textbook. So we feel that how we think that when we are doing Netra Chikilsa, what is the importance of Basti? So Chakshu Prinayati refers that much importance is there Basti in even Netra Yoga Chikilsa. In Netraroga Chikitsa, Vasti is indicated Timira, Kaja, Linganasha and Adimantha. We call it a Chakshushya Vasti. We know that what is Chakshushya, which is better to the eyes. Again, Bala Patola Vasti is explained in Kalpasthana, and which is Chakshur Balam Shikram Ubadadadi. So in our clinical practice, we use Bala Patola Vashkashaya Vasti, especially in RP and in retinitis pigment. Diabetic retinopathy and diabetic maculopathy. In majority of the retinal disorder, we use Bela Patola the Kashaya Vasti. And again, Mathudeli Gavasti. Mathudeli Gavasti, say Yeshti Yukta Madhugesha Chakshushi. So even the Mathudeli Gavasti, when it is explained in Kalpasthana, Mathu Taile Same, Kashaha Saindavad, Dibiju Misi, Erenda Mulakwadena, Rasayanam Prameharsa, and Sayeshti Madhugesha Chakshushi. When it is the kalka is added Eshtimathu, it is indicated in as only in Chakshutya and it is Rekta Pitta Hara. We know that Netra is Rekta Pitta Prasadana and majority of the Nesara Rogas are related to Rekta Pitta Hara, Rekta Pitta. And the Sashti Madhugaischa Chakshusha Basti is actually Rekta Pitta Jit. And it is a part of Madhudelika Basti and which is very widely practicing. Mustapadadi Rajayapana Basti, which is also Chakshusha and Rasayana. So that also we practice especially in diabetic retinopathy. So there are some diseases which is specifically indicated Vasvasti, that is the Krichurumila. We feel that it is a simple disorder, but it is not a simple disorder. It is a chronic dry eye syndrome where all the treatment fails. When in modern ophthalmology, there is no proper medicine for dry eye syndrome. So only application of methotrexate drops throughout the life. When we are doing Krichurumile, Puranajyam, Dracha Kalkampu Sadidam. So when we are using Dracha Kalkampu Kruda for Snehapana, Nasya and Anjana and even in Vasti, we have found that it is completely vanishing and then meibomian glands get repaired and the new tear fluid is secreting or the accessory tear fluid or the oily layer is secreting after the Shodhana therapy. So many cases we have done as it is in Vasti is giving maximum result in especially in dry eye syndrome. That's in Krichurumila. Then Puyalasa, Ajaga, Vadiga Timira, Kaja and all the disease Panchakarma Chikitsa is indicated, especially in Drishti Yoga. Upadare, Anjana Vasti, Vastikriya, Tarpana Legasegi. Vastikriya indicate, Vasti indicates Sirovasti and Vastikriya indicate the Pancha Shodhana Vasti, that is Yoga Vasti or Kashaya, Kala Vasti or Karma Vasti. According to the need, we used to do the various type of Kashaya Vasti mixed with the Sneha Vasti. Retina is Astyashrita Patala and Chadurtham Patalam Astyashritam. So Astyashrita Patala is actually contributes many diseases. We know that there are two categories of disease, anterior segment disorder and posterior segment disorder. Posterior segment disorder comprises mainly the retinal disorder where all ophthalmology fails. Even in diabetic retinopathy or in all other retinopathy, maybe RP or whatever it may be, the diseases are actually, there is no end. There is no option, there is no treatment in any of the medical system. Only we contribute certain thing where we can improve the dead retina to a revitalized retina by using Rasayana and our Vasti Chikitsa. So in modern medicine, pars plana vitrectomy or laser photocoagulation or otherwise intravitreal injection is the option of choice. And after repeated intravitreal injection, the eyeballs get rotten and it is completely lost. The vision may have completely lost. So we have contribution to the retinal disorder by means of our Panchashodhana Chikitsa. Dosha Viched Achakshushya Ahara Vikara produces diseases. So this movement is regulated by Vata. Or we know that Pittam Pangu, Kafam Pangu, Pangavo Mala Vata, Vayuna Itra Niyante. Wherever the disease or process, whatever it may be, even in the Samprapti, when we have Dosha has to move, Vata has to contribute. So without Vata, there is no disease. So we know that of the annual propagation of importance of Vata in all the manifestation of the disease. Even though we call it as single disease, it will be usually associated with the Vata. Naigadosha stado rogaha. There is no disease which is alone with single dosha. Keeping Vata in its original state and its proper site, its important management of Netra Roga. Three principal roots of disease are Shaka, Koshta and Marma. Vata is considered specific therapy for Vata Jaroga and even Vasti is considered specific therapy for Vata Jaroga and which is main important treatment of Vata where it is used in our Netra Roga, especially in diabetic retinopathy. The effect of Vasti is not limited to Pakwasya and Shodhana of malas alone but produce widespread systemic effect. Vasti act throughout the body, it drugs travels from feet to head as per Acharya Charaka. Pakwasya sto ambargo, bhume arko resaniva. Even though we are applying the Vasti in the anal route and it may come within 3 minutes or 4 minutes, the efficacy results in the whole of the brain. So even in Pakshagata, wherever with the case we take, we are giving a parallel route medication. That's why told even in the Adhisara. We never expect it to give results in such a disorder, especially not only in the gastrointestinal, even in the nerve system. It's specifically indicated in Vatika disorder with the addition of various types of medicine to diagnose. So sometimes we won't be lacking an ophthalmoscope or a acute check to see the diagnosis, to see the blood sugar, even though Priya Pipiligadinam, Acharya told Priya Pipiligadinam. Even that is not needed actually. While seeing the face itself, we can diagnose the case. So Chakshushya Basti. Actually, this is the topic, Chakshushya Basti. It's a type of Siddha Basti. Having all contents of Madhudelika Basti along Eshti Madhu Kalka act as Rasayana, Pramehahara, Chakshushya and Rektapittahara effort. Sa Eshti Madhuga Seva, Chakshushya Rektapitaja. Madhudele Same, Karshaha Saindavat, Dibiju Misi, Yerenda Mulakwathena. So Madhudelika Kashaya Basti is explained like that, and along with that, Sa Eshti Madhuga Seva, Chakshushya Rektapitaja. So this is the drug which is a medicine where we use in our management in diabetic retinopathy. Kashaya is Herenda Mula, Madhudela and equal quantity, Kalka, Shatapushpa and Eshti Madhu, Sainthava. So Belavadalati Vasti is another one where Chachud Balam, Chaubadadi Sadhyaha. And again, that is Musta Pathadi Rajayapana Vasti, which very frequently used in pediatric cases, especially in cerebral palsy and etc. Chachushya Putrado Raja, Yapanana Vasana. We say Yapana Vasti, Yapano Khana Kalkena, Matu Tailera Sajyavan. So where Mamsa Rasa is also added, as it is indicated in, especially in Kaumara Pritya, those who are having developmental disorders. Okay. So actually it is due to, we are adding Mamsa Rasa inside. So Madhu, the qualities of Madhu, no need to explain. Everybody know that what is Madhu. And it is a part of Kashaya Vasi Yoga and Sainthava. We know about Sainthava, Vishyandi, Sukshma, Tishna, Snigdha Guna and Taila. Also we know that everybody knows that what is the guna of Yavai, Vishnu Guru, Snigdha, and this all we studies in basic principles and Dravya Guna Vitnana. So when we in Panchakarma, we just add the drugs and give a preparation. So this one I have to explain. This come to the our ophthalmological part. Kalka and Kvadha Dravya. Kalka used to be Eshti Madhu and Shatapushpa and Kvadha Dravya. So according to the need we change. So predominantly we take around Mula Kvadha. In the diabetic retinopathy case, when we treat, there will be usually macular edema. When hypertension, retinopathy, macular edema will be there. So in edema cases there, the simulum kashayam is added. Not only the erenda mula kvata, the simula we know that it is Shodha Haragana. So the simulum kashaya, when we add in this yoga, so result is quick. Compared to erenda mula kvata alone, when we add the simulum kashaya, the result is more implicative, and we can get the result or assess the result very fastly. So when we are adding Reshimatu, it is Rasayana, it gives repair of retinal cells. Where in diabetic retinopathy, the retinal cells are undergoing dot and blot hemorrhage, and the nerve cell fiber is undergoing hard exudates or soft exudates. Exudatory changes are there. In such changes, when we are using the medication, after the assessment or before and after the assessment, we have seen that the change in the hard exudates or soft exudates is removed, and moreover, the dot and blot hemorrhage is vanished, and the cell become healthy. So after treatment, the vision become with 6/12 in OD and 6/9 partial, and we can see that a detached retina, even though it is attached, the whole of the hemorrhage, whole of the retinal edema is vanished after 21st day. After 21st day after treatment. So this person is admitted for 20 days in the hospital, and he is given with Kshiravasti. Actually, we given the treatment begins with Rukshana with 3 days, usually giving Panchagola Churna or Vaishwanra Churna, or maybe in some cases Takradhara. This person is given Takradhara, then Snehana with Jivanya Krita, then Abhyanga Ushma Sweda, Virajana with Sarkarela Trivuchurna, Madhyukta Virajay, according to Vagbata, Ashtanga Hridaya. Sarkarela Trivuchurna, Madhyukta Virajay. Then given Nasya with Jivanya Krita and Anjana with Sharibadi Gana. Sharibadi Varti, as according to Ayurveda, Ashtanga Hridaya. Then given for Kshiradhara and Tarpana with Durvagrida prepared in our own college. That is only Durva Swarasa with Kausgi. Only Durva Swarasa with Kausgi, no other medicine. Only Durvagrida plain. Then Tarpana for 5 days and one Pudabaga, that is Brahmanapur, Lekhana Pudabaga. So that after 21st day we took the OCT again. So after that, he got back the whole vision. So on 16th day he told he can see everything. So whether he can get discharged. I told you have to complete the course 20 days. So 21st day we discharged him. Now also he is not having any problem. He is coming again for 3 months follow-up. I told no first. So when we are giving a treatment, we have to observe the patient till 1 year. So after 3 months he came. Say we took again OCT. There is no change. There is no bleeding. The old retinal tissue is become healthy. So local Lepanam, Bidalaga and Shirobadana Lepana, usually we give Mukhadi only, it's a Kerala preparation. Jaluga Vajana we done. So when there is massive hemorrhage in the eye, in the vitreous, when we are putting Jaluga, it's an Anushastra, just the madam told, it is having less complication. There is no incision, nothing. we are putting a jaluga and jaluga will suck the blood, we will throw the jaluga afterwards. We won't reuse it. So only once we will use the jaluga. So 3 or 4 times used to do in a...
Finally, we extend our heart. I request Dr. to present mementos to our chairpersons. Dr. Praveen Shinde sir was also a chairperson for memento